Dr. George Springer. I practice functional medicine here at LifeWorks Wellness Center. What we're going to talk about today is ADD, ADHD, and the autism spectrum disorder. And as I mentioned in my children's video, which you also can watch on this site, is that this is a subject that's very near and dear to my heart, being a father of 5. We want the best for our children, and there seems to be an epidemic of these conditions being diagnosed. One is because I think that everyone from the janitor to the teacher to the principal in most of these schools a lot of times are now sensitized to the idea that this is a condition or disease. Indeed, the kids can begin to have problems with behavior, but it's not a disease. It's actually an imbalance in their metabolism, and that unfortunately gets overlooked, and they're prescribed all sorts of medication. They're not suffering from a deficiency of Adderall or something to stimulate their nervous system like cocaine would, because all those drugs are in the same basic kind of category. So we're looking for something that goes beyond that. Most patients want something different for their children in those areas. The successes we've had many successes in all those conditions, is we get to the basic physiology of the child, looking for what is it about the nervous system, what is it about the immune system that has caused this child to behave in a different way. And a lot of times the core issues we find relate to digestion, to what's going on as far as diet is concerned, possibility of toxicity and those things that maybe even occurred very early in life from other medications, or sometimes, unfortunately, they can get exposed in just the overall womb, if you will, in terms of what happens in utero, in terms of toxicity from mom. Those things all do have an effect on the child. But when children come in here, they're first glad to know that nothing we do here hurts. And I always assure them of those things, because we can do an assessment that's very non-invasive but very complete, both from the examination we do as well as the laboratory tests that we can run to see how their neurotransmitters are doing. Most children, when they come in, have never ever had their neurotransmitters assessed, but yet they're on all these medications that profess to try and change the behavior by pharmacologically shifting that. Parents don't want drugs for their children. Now, I didn't want drugs for my children, and most patients coming in here who seek me out have the same goal, is to find a more natural solution. And they find that here at LifeWorks, because we're able to get to the cause of what's happening. Give a little credit to Dr. Doris Rapp. She was a pioneer, some 40 years of environmental medicine, and she showed and went around the country, Phil Donahue's show and all over. And what she did is started showing and really opening the path that these kids usually have environmental allergies and or food allergies and digestive issues that they are really beginning to affect their overall nervous system and their immune system. And that's the approach that we have here. We follow in those footsteps, if you will, that she blazed the trail, and then we're able to actually make a change for these children. So our approach is a total approach, a whole body approach to the children, looking at the physiology and then using natural measures to correct what we find. So if your child is, and really your whole family is suffering from the effects of these kinds of conditions, because when the school's affected and the school's calling, the whole family is affected by that. And having had a child that was a bit challenged at times, I have that reality on what's there. So I'd be happy to help you sort that out with your child. If you'd like to give us a call here at LifeWorks, we'll take a look and bring some relief both to you and to the child, and so they can grow up and be healthy, productive citizens.